Hi, my name is Brooke Habiger. I'm going to be doing the IV insert with my MAR. So I would first go ahead and gather my supplies and check my MAR. For this one, I have a D5 normal saline at 100 milliliters per hour. And then we also have our piggyback that'll come in later. Once I check my MAR, I would go ahead and gather all my supplies, check my patient's allergies. I would make sure once I have my solution, I'm going to be doing the 5 rights 3 times. I'm going to want to go ahead and check my solution. The first time when I get my solution, I'm going to want to make sure to check it prior to spiking it and then after spiking it. Once you have your solution, you're also going to want to make sure to check that the solution is good. There's nothing floating in there. There's no leaks. There's no cracks. The expiration date's good. I also have my IV start kit with me. I have my tubing, I have my tape, I have my pen, and my needle. So I'm going to go ahead and while I'm in supply closet, get my IV ready and spike it and prime it. So I'm going to need my solution. Scoot my patient's arm over. My solution and my tubing, and I have my pole ready. So opening up my tubing, we're going to want to make sure to keep 2 parts of this sterile, which are the 2 ends. They both have caps on them as well. Once you open up your tubing, first thing you're going to want to do is go ahead and close the roller clamp so we know that's closed whenever we spike it. Right. And once that is done, like I said, you're going to want to make sure to keep those parts sterile. If you've got your solution, this would do your second check before you spike it. We're going to go ahead and take off the cap. And you're going to go ahead and insert this into your solution. You're going to go ahead and hang this on your pole. Going over the trash can, you're going to go ahead and fill up your tube just with a couple squeezes to where you need it to be. You're going to go ahead and open up your clamp. The fluid will then run through. And then once you have it and it is going through, see the fluid come out. And you can go ahead and close your tubing back up. And keeping this cap on, you're going to go ahead and put your tubing up here so it's all ready to go into the patient's room. Alright, so we have our IV set up. So we're going to go ahead and go into our patient's room. We're going to go ahead and knock. We're going to go ahead and provide privacy. We're going to go in. As we're doing our hand hygiene, washing our hands, you can go ahead and ask the patient if they've ever had an IV in, if they've ever had previous surgery on one of their arms, maybe if they have some scarring, if they have any burns, if they have a mastectomy. You can ask them for their preference. It's not always what we're going to use. That will be the last thing that we use, determining which arm to use. So once you've figured out which arm, like I said, you're going to perform hand hygiene. You'll go in and get all your stuff ready close to your patient. So we're going to do the D5 normal saline at 100 milliliters per hour. I'm going to go ahead and get all my stuff opened up and ready to go. Set that there. So for my pump, we can go ahead and get that ready. You would go ahead and turn on the pump. You would go ahead and put the rate, which the rate is going to be 100 milliliters. And then you would do this second button, and that's going to be how much solution is in your bag. We'll do it over 500, and then we can go ahead and let that sit for a minute. We can go ahead and take our tubing and we can put it into our pump and get that all ready, set up, ready to go. Make sure there's no kinks. Make sure that the air clip is in there so it's tight and everything is good. So that is all ready after our injection. We're going to go ahead and bring our tubing closest to our patient. So that is ready. And we'll go ahead and get our tape ready. And then you're going to want to make sure that you have initials on your patient's tegaderm, on the actual solution, and on the tubing. We'll write that out. Put that on your solution. We'll write that out. That goes on your tubing. And then we'll write out our label that goes on the tegaderm. Place that over there. We'll get our needle ready. We're going to go ahead and pull it out. We want to make sure this stays sterile. We want to make sure that we pull this up a little bit just so we can make sure that it's going to come off easily when we inject it. We'll place that close to our patient. We have our tegaderm that we have ready. We have some gauze, we have our cleaner, we have our tourniquet, and we have our gloves. We can go ahead and place the tourniquet underneath the patient's arm. So we can go ahead and tie the tegaderm. We're going to go ahead and find the vein that we're going to use. So you can go ahead and palpate around and find the vein that you're going to use. Once you find that, you're going to go ahead and release the tourniquet. Go ahead and get your gloves on. All right. And then you can have your patient look away if they don't want to see the sight of blood, if they don't want to see the injection happening. Some people do get kind of queasy at it. So we're going to go ahead and make sure we get them ready. And we can go ahead and start out by taking our cleanser, and we would go ahead and pop this. And we would go ahead and go to the whole area around it. Make sure that's all clean. Make sure to dispose of that. We're going to go ahead and put the tegaderm back on. Make sure that it's tight, but not too tight. There we go. It's not going to stay on my towel. Okay, there we go. So I'm going to go over here so it'll be a little easier because I'm right-handed. I'm going to go ahead and get my needle prepared. You're going to make sure to do the bevel up. I'm going to go ahead and take my non-dominant hand and hold below the vein. So I'm holding the vein to stabilize it. I'm going to go in at a 15-degree angle. I'm going to go ahead and inject the vein. Once I see blood flow come back into the flash chamber, I'm going to go ahead and insert the cannula, not inserting the needle with 2 fingers. Once I have that, I'm going to go ahead and release my tourniquet. Go ahead and release my needle, and there's normally a safety that you can press right there. We're going to go ahead and undo that and connect that. And then from here, you're going to go ahead and take your tegaderm and place it over the cannula, but not over so it's interfering with anything else. I'm going to go ahead and make sure that is secure. Discard of that. And then you're going to go ahead and take your tape and you're going to go ahead and do the chevron method and secure that to the patient. And then you're going to go ahead and take your other piece of tape and you can go ahead and attach it to your patient's arm. You can go ahead and press start on your IV pump. Once that is filtrating, you're going to go ahead and open up your chamber so that it is going to be able to flow through. You're going to go ahead and take out your tourniquet off the patient and remove any kind of excess stuff. You do have this in case any kind of blood flow gets on there as you're injecting it. You want to make sure that your IV solution is pumping. You can make sure that you can see it as it's dripping, make sure that it is going in the patient. You can go ahead and make sure that you have all your stuff for documentation. how the patient responded to the IV being placed. Make sure to throw your needle in the sharps container. Anything else that has blood products, make sure that goes in the correct container. Make sure your patient doesn't eat anything else, and you are good to go.